support learners in need. Drop off your donations at Save Hyper 362 Victoria Road or at Radio Al Ansar 240 Ortman Road, Monday to Friday, 9:30 to 3 p.m. Let's come together, uplift our community, and make a real difference, one child at a time. School Matters, Save Hyper, and Radio Al Ansar, because education starts with dignity. Radio Al Ansar, 24/7, 365.
The views and opinions expressed by the guests and presenters of Radio Al Ansar are not necessarily the views and opinions of Radio Al Ansar and the Al Ansar Foundation.
Doctors and guests on the Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
You are listening to a live broadcast from Radio Al Ansar, Pietermaritzburg, 105.6 FM.
There's a pathway to peace if you want it. The street is surrounded by thoughts. Oh, you'll see in spaces you think you like, but they're only there so you stray from the course. Every chance that I get when it's feeling so hard, praying for guidance and hoping you honest my heart. Love and faith filling up, but I know it will fall. It isn't for long. Can't stop it. Won't slow. Keep walking. We fall down.
You're listening to a live broadcast from Radio Al Ansar, Pietermaritzburg, 105.6 FM.
Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to Radio Al Ansar 90.4 and 105.6 FM. I am Shubnum Ismail on the PMB Pulse Show on this Saturday. Alhamdulillah, all praise belongs to Allah, the most merciful and the most compassionate, who has blessed us with health and the ability to seek knowledge. May peace and blessings be upon our beloved Prophet Muhammad sallallahu alaihi wasallam, his family, companions, and all those who follow the straight path. Welcome to a special episode on the future of radiotherapy, advances in treatment and care. As we share our expertise here today, we are reminded that cancer affects us all, either directly or indirectly, but you are not alone. Joining us today is Akshay Budhram, who is a leading expert from IntelliRad, and he'll share his insights on treatments, once diagnosed, and so much more. So let's dive in and empower ourselves with knowledge and hope. Welcome to the Pulse Show, Akshay. It's great to have you all the way from Durban this morning.
Thank you very much, Shubnum, and thank you to the listeners for having me here today.
We've got so much to cover, so I'm really excited about the content, and there's some really interesting questions we're going to unpack. It's all about education. Listeners, Akshay Budhram is the Group Radiotherapy Manager at Hopelands Cancer Center, where he provides strategic and operational leadership across multiple radiotherapy units, so including IntelliRad in Pietermaritzburg, KwaZulu-Natal. So with a strong clinical background in radiotherapy planning and treatment delivery, Akshay is dedicated to driving excellence in radiotherapy operations and advancing patient-centered care. His focus is on ensuring the safe and efficient delivery of high-quality cancer treatment, while also embracing innovative technologies to enhance treatment precision and patient outcomes. As a champion of innovation in South Africa, Akshay has introduced cutting-edge technologies such as surface-guided radiotherapy and advanced treatment platforms. His work is centered on improving patient experiences and outcomes, making a tangible impact in the fight against cancer. Through his leadership, Akshay is shaping the future of radiotherapy in South Africa, setting new standards for cancer care and treatment. And with his expertise and passion, he's making a significant difference in the lives of patients and their families. Wow, Akshay. So let's begin the journey together, seeking Allah's guidance for strength and wisdom. So, can you tell us, Akshay, what is cancer stance on radiotherapy as a treatment option?
Okay. The Cancer Association of South Africa fully supports radiotherapy as a proven and an effective treatment for many types of cancers. So, Shabnam, in fact, radiotherapy is considered a cornerstone of cancer care, whether the aim is to cure the cancer or control it long term or just symptom control. A center like IntelliRad aligns closely with this approach by delivering safe, evidence based radiotherapy while also making sure that the patients feel supported, informed, and cared for throughout their treatment journey.
So, tell us, Akshay, what does radiotherapy really entail?
Basically, radiotherapy works by using high energy X rays to damage the cells so they can no longer grow, or we say divide. What's important to know is that modern radiotherapy is very precise. It's designed to focus on the tumor while protecting healthy tissue as much as possible.
And what types of cancers our patients would obviously have that they would require radiotherapy?
Radiotherapy is an indication to treat a wide range of cancers. And these indications include breast, prostate, lung, head and neck, cervical, colorectal, skin cancers, and even brain tumors. The treatment plans are always tailored, though, to the individual and the specific cancer type.
I'm sure that when a patient's diagnosed and then they actually speak to the doctor and he says, look, you have to go for radiotherapy. And with radiotherapy, it's obviously the fear of, the side effects. Can you talk us through about some of the side effects?
Yes, the fear of an unknown can always be daunting on an individual. But side effects, it can be very broad-based, actually only on the treated area. Commonly, the side effects include tiredness, mild skin reactions, and temporary changes to the treated area. And these changes are such as bowel or bladder irritation in some instances. Most side effects, though, are manageable and short-term, and patients are monitored closely when having radiotherapy.
So how can your patients manage some of these side effects?
Patients, remember, are never left to manage alone. At IntelliRad, they receive clear guidance, regular reviews, and they have access to the care team. So simple measures like skincare, hydration, nutrition, and even just taking a rest makes a big difference during radiotherapy treatment. Patients are also encouraged to speak up early if something doesn't feel right, so we can advise them accordingly.
Akshay, you mentioned something that's so important. You're never alone. So any patient going for any treatment besides cancer as well, remember there is support groups, for example, diabetes support groups, etc. So we hand holding you here today. If you need to speak to somebody, there's experts out there, and this is actually real. In terms of radiotherapy, I believe it's not a one-time session. So how frequent would somebody go, and how do you guys monitor progress?
Okay, so the treatment fractions differ from patient to patient. Most radiotherapy is delivered over several sessions, or we term it as several fractions. And it's usually once a day, over 5 days a week. This approach allows cancer cells to be treated effectively while giving the healthy tissue time to recover and repair.
So if somebody walks in and has a typical radiotherapy session, what's the time factor?
So the actual treatment usually takes a few minutes, especially with the new modern equipment that's now made available for patients. Although the full visit ranges between 15 to 20 minutes, there's a lot of time and care that goes into accurate positioning before the treatment actually starts.
And in terms of radiotherapy, what is the difference between external and internal?
So external radiotherapy delivers radiation from outside the body using advanced machines like the Halcyon, for instance. Internal radiotherapy, or we say brachytherapy, places radiation close to the tumor. Both methods are very well established, and the choice depends on what's best for the patient and the condition.
So, does radiotherapy really target the cancer cells specifically?
So, modern radiotherapy, may I say, is all about accuracy. It starts with detailed imaging and careful planning, where the treatment is mapped out before it even begins. At IntelliRad, each patient's treatment is planned so the radiation is shaped to match the tumor as closely as possible, which helps to protect the surrounding healthy organs. During treatment, we also use advanced camera systems that monitor the patient's position in real time. Even small movements are tracked, allowing treatment to be delivered with extremely high accuracy right where it's needed.
That's very special. Obviously, that patient's life and obviously getting things right firsthand is very imperative for you guys. And I've seen your technology. I've been to your base. It's very modern. It's very trendy, but it's very precise. And I'm sure it costs a lot of money.
Yeah, it's worth the investment. Our patient's at the center of this investment.
That's beautiful. In terms of chemotherapy, can radiotherapy be used in conjunction with other treatments?
Yes, very often. Radiotherapy may be combined with surgery, chemotherapy, hormonal therapy, or even immunotherapy. Again, it depends on the cancer and the treatment goals, which are set by the oncologist. Cancer treatment is a team-based approach. It's not just managed by an individual. It requires an entire team in managing.
So tell me, actually, you work with multiple oncologists. You got to be up to date in terms of technology. Can you actually highlight what are some of the advancements when it comes to cancer and technology and therapy?
Yes, sure. Radiotherapy has changed tremendously over the year. Today, treatments are much more accurate and a lot more gentle on the patients than they used to be. At IntelliRad, we use modern machines, like I mentioned earlier, the Halcyon, which delivers treatment quickly and very, very precisely. We also use motion tracking systems such as surface-guided radiotherapy, which monitors the patient's position during treatment to make sure everything stays exactly as planned and exactly on target. All of these means that we are able to deliver treatments more safer, more comfortable, and to deliver it with much more confidence.
In terms of your patient's overall health impact, can you tell us a little bit about the effectiveness of one going for radiotherapy?
Yes, patients' general health is very important. Nutrition, medical history, all play a role. That's why we say treatment is individualized, and there has to be a regular assessments throughout the course of treatment.
Are there any long-term effects of radiotherapy?
So most patients do very well long-term. While late effects are possible, the modern planning techniques significantly reduce these risks, and patients continue to be followed up after treatment by their treating oncologist.
I'm sure. I mean, I've seen it firsthand when I worked in acute, doctor diagnosing you and saying, look, you got cancer. I mean, obviously so many things go through your mind. And, obviously in terms of now telling you got to go for treatment. So how is radiotherapy planned and personalized for each patient?
So before treatment starts, every patient has to have a planning scan, which helps us to map out the area that needs treatment. To keep everything as accurate as possible, we sometimes use immobilization devices, like a custom treatment mask, to help the patient stay in position each day. From there, the treatment is carefully designed by a multidisciplinary team. There, we tailor the dose and technique specifically for the patient and the area being treated. Before the first treatment is given, we do several checks to make sure everything is correct. Throughout the process, strict quality checks are followed to ensure treatment is safe, precise, and delivered exactly as planned.
The next question obviously stems from what we discussed earlier. Look, you're not alone.
Yes.
So what support systems are in place for patients undergoing treatment?
So support goes beyond treatment delivery. Patients at IntelliRad have access to clinical support, and this includes nursing, staff, radiotherapists, and the oncologist. Education, which is also provided prior to treatment, and there's referrals to counseling or cancer support services where needed.
I think that's very important, Akshay. We come across families, they also go through the emotions with, their family member being diagnosed. And I think education is key. Everybody just needs to be kept abreast with everything. And I'm sure you walk through that journey with your families. And do you guys have a support group locally? And can family members be involved in radiotherapy sessions?
Absolutely. I think family and caregivers play a vital role in emotional and practical support. And we encourage our patients, families to be involved in the patient's journey, as this journey is not an easy journey. Emotional support is needed during this treatment process.
Of course. So, how does radiotherapy impact daily life during treatment? I'm sure you have patients that normally go to work. And what advice would you give somebody that's probably going to be a fresh starter with starting radiotherapy?
So, personally, I feel radiotherapy shouldn't stop your personal life. Many patients continue with their normal daily activities. And as you said, this includes work during treatment. Some may need to pace themselves due to fatigue, and the team helps them to adjust as needed.
Not only the actual therapy and getting obviously the medical side into your system, but I'm assuming that diet plays a role as well. So do you guys work closely with the dietitian, and what advice would you give in terms of meal plans and eating? Because obviously, you see patients, some of them might lose weight, and I think stress plays also a major role in trying and keeping the metabolism and the energy levels. So, any advice in terms of diet, eating, lifestyle changes?
Yes, good nutrition and hydration is absolutely important when receiving radiotherapy. Depending on the treatment area, patients may receive a specific dietary advice to help manage side effects and maintain strength. If there's need, we will engage with a dietitian to help support the patient during treatment delivery.
You see a lot of palliative patients?
Yes, there is.
And the treatment thereof?
Yes, radiotherapy is very effective in a palliative setting. It's effective for relieving pain, reducing bleeding and symptoms, and even improving the quality of life when cure, unfortunately, isn't the goal in that setting.
Listeners, you are plugged in on Radio Al Ansar in Pietermaritzburg, and we have radiotherapy specialist Akshay Budhram in the Pietermaritzburg Pulse Show with myself, Shubnum, Ismail. So let's step out for a quick advert break, and when we come back, we'll dive into the effectiveness of radiation therapy. So please stay tuned with us.
Radio Al Ansar.
Guaranteed to beat any advertised price or written quote. Yes, you heard right.
So head down to Simplex Radio and get the best deals in town.
Grab a Midea 20-liter microwave for just $5.99.
A Defy oven and hob combo at $4,499.
A Samsung 19 kg top loader for $7,499.
Or a stylish Smeg kettle or toaster for $2,399 each.
Hurry, offers valid until January 31st. Simplex Radio, the name you can trust.
As school opens, School Matters in partnership with Save Hyper and Radio Al Ansar is calling you to help a child step into the new year with confidence. We're collecting school uniforms and school shoes, new or gently used, to support learners in need. Drop off your donations at Save Hyper 362 Victoria Road or at Radio Al Ansar 240 Ortman Road, Monday to Friday, 9:30 to 3 p.m. Let's come together, uplift our community, and make a real difference, one child at a time. School Matters, Save Hyper, and Radio Al Ansar, because education starts with dignity.
Get ready for Green Thumbs Up, the gardening and natural living show you didn't know you needed. I'm your host and life coach, Rabia Carvalho, and we're talking birds, bees, butterflies, and blooms, growing food and garden rooms, home-based holistic healing, and much more. Whether you're a seasoned gardener or nature lover, planter or permaculture professional, we got you. We got you. Let us bring you the ideas, the facts, support, and inspiration to go green wherever you are. Sundays 9 to 10 a.m. only on Radio Al Ansar.
Ramadan is around the corner and preparation starts now. Get ready for a blessed month with Ramadan specials at the Al Ansar shop. From premium quality dates, refreshing Zamzam water, to beautiful Ramadan gifting ideas for family, friends, and loved ones. Al-Ansar shop has everything you need to welcome a whole month. Perfect for iftar and meaningful gifts that come from the heart. Visit Al-Ansar shop today and prepare for a call 031-208-1601 or visit us at 2 West Road in Overport. Al-Ansar shop, preparing hearts and homes for Ramadan.
Radio Al Ansar welcomes your feedback. If you have a broadcasting related complaint, please put it in writing and address it to the head of the complaints committee. Include your full name, contact details, a clear description of your complaint, and any supporting documents. You can email your complaint to feedback@alansar.org.za. That's feedback@alansar.org.za, or bring it in person to our Petermaritzburg office at 240 Ortman Road, Willowton. Your input helps us serve you better.
Radio Al Ansar, 24/7 to 65.
Doctors and guests on a medical files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
Radio Al Ansar, Petermaritzburg, 105.6 FM.
There were some hard times. We were living some dark lives. We did not know where we're supposed to be. We did not know what we're supposed to need. We took the time out to teach us, so that the guidance would reach us, and you know it will. Muhammad ya Rasulullah, sallallahu. Ya Rasulullah, sallallahu. المولى عليك وسلم المولى محمد. Look up to the best of the men, and I'm working on the test to the end by following the message we sent and try turning these lessons into action. Oh, I pray for the day that I see you in my dreams. Rahmatan for all humanity. You gave me the blueprint of life, taught me the rules in the right, shining like the moon in the night. This is how we speak on your life. We was all in need of a guide, and the Lord you sent us. Muhammad ya Rasulullah, sallallahu. Muhammad ya Rasulullah, sallallahu. عليك وسلم المولى محمد. عليك وسلم المولى محمد. For the day that I see you in my dreams, Rahmatan lil Alameen, for all humanity. And oh, I pray for the day that I see you in my dreams, Rahmatan lil Alameen, for all eternity. And I hope my heart never loses the love. I keep strong when times are rough. In this faith I will always trust, and that's enough for me. I know guidance comes from above, so I'm placing my head on the floor. God align His messenger, and that's enough for me. Muhammad ya Rasulullah, sallallahu. Muhammad ya Rasulullah, sallallahu. عليك وسلم المولى محمد. عليك وسلم المولى محمد. محمد يا رسول الله، محمد يا رسول الله، عليك وسلم المولى محمد. عليك وسلم المولى
You are listening to a live broadcast from Radio Al Ansar, Petermaritzburg, 105.6 FM.
I don't wanna walk with you no more. I will never leave my crib. I know that you're always there. For every door that you close, you'll guide me to many more. So many ways You show me your love. I'm thankful for all that you've done. For all that I have, for all that I lose, still leads to you. For the nights that I need now, my face meets the ground. For you do that I have, you still pull me through. For the nights that you're all I need now. على كل حال So many ways you show me your love. I'm thankful for all that you've done.
To a live broadcast from Radio Al Ansar, Pietermaritzburg, 105.6 FM.
أعوذ بالله من الشيطان الرجيم. Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. And welcome to Radio Ansar 90.4 and Pietermaritzburg 105.6 FM. I'm Shubnum Ismail on the Pietermaritzburg Pulse Show. And today we are focusing on strengthening our health with Akshay Budhram, a radiation therapist. Welcome to the show, Akshay.
Thank you, Shubnum.
It's great to have you with us, and we've been unpacking some great content regarding cancer and radiation therapy. So, alhamdulillah, listeners, with expert insights, let's begin, inshallah. So, can you tell us a little bit about your career, and if a student actually wants to specialize in the field of radiation, what courses and the journey, and how long is it in terms of getting them into the field of medicine?
Okay, so radiotherapy is a 4-year program, and the prerequisites of entering into the profession is that in your schooling career that you need to do natural science, as well as including physics and biology and mathematics. This is a 4-year degree, and during the degree itself, one has to undergo clinical work experience. So it's coupled by both academic tuitions that you have at the university level, as well as real life work integrated learning that you do at a specific unit. For IntelliRad, for example, it's an accredited unit for student intake. So we allow students to come through and train and get practical experience on a day-to-day basis. Students are then allowed to complete a stipulated amount of hours, and once they complete the hours, they are now clinically competent to actually treat patients after the 4-year degree.
Mashallah, listeners, if you have your family member that's in the field of oncology and need to get some training, we will share IntelliRad's and Akshay's details at the end of the show so they can go and do some internship and see what happens behind the scenes. So Akshay, in terms of South Africa and the market for radiotherapy, do you think there's a need to have more radiation oncologists and therapists in the field?
Definitely. We have a large population in South Africa that is underserviced in terms of radiation oncology. A lot of the radiation facilities are built in the metropolitan areas, and I think there's definitely a need for us to focus on having radiotherapy facilities in the more remote settings to allow better access to care for these patients. Oncology itself is a super speciality, and I think we need to expand these services beyond just the cities.
So what you like most about your job, it's not easy dealing with oncology patients. You got to be empathetic, have a good listening ear. But can you tell us what's the best part of your job?
Apart from the technical aspects and using this advanced equipment and machinery, I think, as you said, it's the rewarding aspects of being a radiation therapist. It's actually going beyond just treating a patient, but it's actually bonding and going through this journey with the patient on a day-to-day basis. It's not a once-off experience. It's an experience over several weeks, and you build a relationship. You hold the patient's hands and take them through this journey step by step. And the rewarding part of it is actually seeing the progress that the patient makes. The fact that the patient comes through every day, holding their head up high and going through this journey, because it is a difficult journey for that patient.
Okay. Can relate to you. It's about the progress and actually walking through that journey. You know, I work in a rehabilitation setting, and it's amazing to see somebody come through and they're able to walk again. And it's similar with our oncology patients. You want to see and give them the gift of life. I know earlier you spoke about the multidisciplinary team, and you do a lot of traveling and you connect between sites. So can you elaborate about the team and who you work with and how that team comes together to be part of the patient's journey?
Yes. So each person in the multidisciplinary team has a purpose, and there's clear roles and responsibilities. But the goal is to be working cohesively together to provide the best outcome for the patient. In the team, it consists of the oncologist, who does the prescription and the medical management of the patient. We have a medical physicist who ensures that our equipment is operating adequately, as well as the background checks and the quality controls within the patient's treatment. We have the radiotherapists who plan the treatments as well as deliver the treatments. And of course, I have to mention our support staff, which is our admin. It even goes down to our cleaning staff, who also ensure that our units are clean and are kept at optimal standards for our patients coming through.
Excellent. So can you tell our listeners what research is being done to improve radiotherapy outcomes?
Yes. For radiotherapy specifically, there's a lot of research, and most of the research focuses on a greater precision and fewer side effects, and that's the ultimate goal. And we look at also research in integration with other cancer treatments.
I see there's a question from one of our listeners. Is there pain while having radiotherapy?
So most patients, this is a very common question that most patients ask me, in fact. And often my answer to them is like, having radiotherapy is like having a chest x-ray. It's pain-free. You wouldn't feel anything. You wouldn't see anything. It's exactly like having a chest x-ray done.
So there's obviously the patient has to give consent. So how would a patient know if radiotherapy is right for them?
So this is very important, okay? This is a shared decision made with an oncology team. It's based on medical evidence specific for that cancer type. Patient preference is also important, and the overall treatment goals.
In terms of the success rates, can you actually tell us radiotherapy and its effectiveness?
Radiotherapy plays a key role in treating many cancers. Success, or rather may I say, the management depends on the cancer type and the stage. But outcomes have improved significantly over time.
I hear you. And how does radiotherapy compare to surgery for certain cancers?
In some cancers, radiotherapy can be as effective as surgery, while in others, it complements surgery. For me, the aim of treatment should always be the best outcome with the least impact on the quality of life of the patient.
So basically, the doctor would look at the patient and decide before we go into more complex surgical procedures. Let's trial the basics and go through the journey first. And if it becomes a challenge, then probably look at bigger surgery. And that's where your multidisciplinary come in. You obviously converse with your surgical doctors, etc.
Correct. So as I said, it's managed by a multidisciplinary team. The surgeons and the oncologists will discuss what's the best treatment plan, whether it's combination of surgery or whether it's radiotherapy on its own. So that discussion happens up front before we actually determine the clinical care path for the patient.
Communication is key. Alhamdulillah, listeners, we're going to pause for a beautiful nasheed break. Let the soothing moment remind us of the peace and balance we seek in both faith and health. Inshallah, the melody will refresh your spirit this Saturday before we dive back into our discussion on treatment once diagnosed with cancer. Stay with us. We'll be right back.
जानी सारों को सलाम फातिमा ज़हरा के प्यारों को सलाम या हुसैन इब्ने अली मुश्किल कुशा या हुसैन इब्ने अली मुश्किल कुशा आप as an angel. The devil's alive, keep you alive. These strings together lies, suddenly you're tangled. I took your hand as you opened your wings, and I thought I could fly. The devil is disguised as an angel. The devil always tries to keep you down. He strings together, suddenly you're tangled. I finally let go of your hand and I crashed. The devil is disguised as an angel.
24/7, 365.
Imagine this. Lunchtime hits and you pull out papa and cabbage. Or that same sad sandwich mom made when you went to school. Eish. Now flip the script with the Debonairs Pizza Real Deal range. You get 6 meaty flavors that turn boring into brilliant. Barbecue bacon, Debonairs chicken, Russian and more. Enjoy more with... Choose one of 6 meaty Real Deal flavors for just 29 Rand 90 each. Debonairs Pizza. Try something amazing.
J.Junaid Jamshed. Summer Gala sale is now live. Enjoy flat 50% off from 22nd January to 1st February. Visit our store at 222 Felix Lamini Road, Overport, or shop online at za.junaidjamshed.com.
This and only this is Nightline. Nightline is the only program that allows you to listen to the opportunity to voice your opinion on any matter or any topic that concerns you. Also on Nightline, we interview the famous, the not so famous, and infamous. Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Brother Muhammad Varyawa, and with me in the studio is Dr. Anwar Jiwa. Join us every Saturday night from 8:30 p.m. till 10:30 p.m. on Nightline, the program designed especially for you, the listener.
Join me, Buddy Governor, for the Sunday morning edition. Sundays, 8 to 9 a.m. Coffee, current and public affairs, newspapers, food, trends, health, and nasheeds. Setting you up for a relaxed morning with topical and conversational items, as well as spiritually uplifting and warm nasheeds. Breakfast tips and recipes for a healthy lifestyle. An easygoing intro into your Sunday morning with me, Buddy Governor, the Sunday morning edition.
Radio Al Ansar, 24/7, 365.
Doctors and guests on a medical files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
You are listening to a live broadcast from Radio Al Ansar, Pietermaritzburg, 105.6 FM.
The heart is turned away, feels emptiness inside. The rain keeps falling from the sky. Turner of hearts, keep me on the straight path. Don't ask God, take me to let me walk away. Keep my heart close to you. I need you every day. When Ask you can find my way. Oh, it's me again. To ini asal jannah. You're the ones that we praise all the time. So many times, but yet my heart was blind. You're the one that is no other way. You're on a straight path, don't just guide me, don't me walk away. Keep my heart, need you every day. Lost, can you find my way? Oh, it's me again. I want you. Oh, ini asal jannah. It's trying to find you. Forgive me, my Lord. Oh, please guide me back. I need you to guide me back. Oh, yeah, you tell my heart. It's trying to find you. Forgive me, my Lord. Oh, please guide me back. I need you to guide me back.
You are listening to a live broadcast from Radio Al Ansar, Pietermaritzburg, 105.6 FM.
Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to Radio Al Ansar 90.4 and Pietermaritzburg 105.6 FM. You have just joined me, Shubnum Ismail, on the Pietermaritzburg Pulse Show, and today we're unpacking everything about the future of radiotherapy, advances in treatment, and we have Akshay Budhram with us, who's an expert in his field, and he's giving us all the insights on managing your treatment once diagnosed. Welcome to the show, Akshay.
Thank you, Shubnum.
So Akshay, we actually getting towards the tail end of the show, and I know it's very important that we actually close the gap with talking us through about care, how we can close the gaps.
Okay, when we talk about closing the gaps in cancer care, radiotherapy is a big part of that conversation, Shubnam. For many patients, access to timely, high-quality radiotherapy can make a real difference to the outcomes of that patient. Delays, long travel distances, or limited specialist support can add a significant amount of stress, and patients tend to feel overwhelmed. At IntelliRad, we support radiotherapy teams by providing expert radiotherapy input and technology that helps ensure accurate planning and delivery of the treatment. The goal is simple: to help patients receive safe, precise radiotherapy as early as possible so they can focus on healing rather than waiting.
You know, you mentioned something very important is accessibility. And obviously, you guys see patients coming from other areas, rural, out of the area in Pietermaritzburg. So can you tell our patients in terms of accessibility, how can you guys maintain the radiotherapy locally?
Okay, in most cases, patients are referred by their treating oncologist. We at IntelliRad work closely with the referring oncologist to coordinate the care and make the process as smooth as possible. If treatment requires traveling or staying away from home, support can often be arranged, whether this is inpatient radiotherapy or even practical assistance for the patient. In IntelliRad, we work with a network of professionals and support services to help coordinate the care plan for the patient. So patients can just focus on their treatment rather than the logistics around treatment.
So would you say patients would find accommodation locally so that you guys can add days to the, so that's all cumbersome into probably
Correct.
a
So
week?
we partner and we facilitate these patient bookings with lodging services, transport services, and this is all part of the care plan that we offer here at IntelliRad.
Oh, mashallah to the doctors and to your team that actually go beyond the call to ensure that you're actually adding that support. And what would you say are some of the signs that radiotherapy is being effective with your patients, or basically, if we could say that progress has been maintained?
So radiotherapy is not always, the result is not always visualized as an immediate response post-treatment. Patients after receiving radiotherapy are followed up by the oncologist, and diagnostic testing is then done to evaluate the response to radiotherapy. These testings may include a CT scan, a PET CT, or even an MRI to evaluate the response of radiation to the tumor. We may even require additional blood tests to see in terms of the tumor markers, if they are rising or if they have decreased. So results can only be assessed post-radiotherapy, maybe a few weeks or months after, and not always as an immediate response.
It can be quite a challenge for a patient going back and having these scans and treatments to see if it's been effective or new cancers. So I'm assuming you also work closely with psychologists and social workers.
Yes, we do. As I said earlier, is if a patient requires psychological support, we engage with psychologists to take them through the journey and offer them that support if needed.
I know once we went offline during our break, you know, we were talking about some of the lovely initiatives and support groups and some of the projects you have highlighted, which we'll unpack to the listeners during the course of the year so they could get involved and support you, like your fun walk that you're going to have in Durban, inshallah, where you creating awareness. And speaking about awareness, there's a beautiful Look Good Feel Better for our female oncology patients, which I know that your organization supports greatly as well, where it's a 2-hour makeup regime workshop. Alhamdulillah, the patient feels pampered. Akshay, you spoke earlier about, you know, the side effects of skincare, you know, once you go for treatment. And we see these patients come through, which is a fully free and sponsored workshop in Pietermaritzburg. It's at Gray's Hospital and in different parts of the city. So please get in touch with us, because those support groups help our patients with healing and get them to feel better about themselves. It's all about, you know, we spoke about you not feeling alone. And we want to support these initiatives so that both the family and the patient feel that they have a sense of hope. Akshay, is there anything you'd like to elaborate about that?
Yes, Shubnum, I think in closing, radiotherapy today is precise, and I just want to let the listeners know that it's safe and it's tailored for each patient. It's very different from what many people imagine. At IntelliRad, we combine advanced technology with genuine patient-centered care, making sure every person feels informed, supported, and confident through the treatment journey. So my message is simple. It's effective treatment delivered with care and always focused on the quality of life for the patient.
Absolutely. Well said. I like to remind listeners, please don't read online information, and not everything is accurate. You listen to the experts and be guided by people that are professional. Actually, thanks for shedding light on radiotherapy and treatment options for our listeners. To our audience, remember, knowledge is power and hope is stronger. So actually, how can our listeners get in touch with you and get more advice?
Yes, they can visit us at our IntelliRad unit, as well as visit our page, IntelliRad, and they can contact us via that web page.
To our listeners, this show is all about keeping you on the pulse and ensuring you are educated. So have you or someone or a loved one experienced a stroke or head injury? Open Hand Support Group, together with the Stroke Survivors Foundation, will be hosting their first support group in Pietermaritzburg, the 17th of February, coming up at 10 o'clock. So contact myself, Shubnum Ismail, for more information. I'll be hosting that workshop together with Open Hands, and my number is 082 360 2590. I repeat, 082 360 2590. So, alhamdulillah, listeners, we've reached the end of today's Pulse episode. It's been an inspiring journey. Jazakallah so much, Akshay, for empowering our listeners and keeping them informed. And to your team, continue to touch lives. May Almighty Allah grant us guidance, health, and strength. As the Quran says, indeed with hardships come ease. Until next time, stay informed and stay empowered. To our Al Ansar family and our technicians, Jazakallah for plugging us and getting our community informed. And so that's a wrap from me. Enjoy your weekend. Shubnum Ismail on the Pulse Show. Jazakallah for all of you listening. Walaikum salam wa rahmatullahi wa barakatuhu.
I have to say goodbye when I crossed over to
Doctors and guests on the Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
You're listening to a live broadcast from Radio Al Ansar, Pietermaritzburg, 105.6 FM.
sweet. And on that celestial day, we'll cross together. You lead the way. You lead the way into love, sweetest love.